Easy. Okay. Awesome. So first off, we know it's well studied as a natural anti-inflammatory. So there's lots of different like articles, like for an example, this oil has also been confirmed as a bactericidal, anti-inflammatory, and anti-herpetic agents. And I said earlier, when it comes to the eye, that's key because a herpes infection of the eye could be shingles. And ocular shingles is very painful and very problematic. And so castor oil, like in my clinical practice, we would apply it topically around the eye in order to help with those types of cases. But always remember that inflammation increases as we age, and inflammation is contributing to all ocular conditions. So a key is, how do we reduce our inflammation? And if you look at this image here, you'll notice like the eye socket is literally a ball. And if there's more and more inflammation, all you do is inflammation causes heat, causes pressure, causes problems, bottom line. So we want to keep our eyes and our liver and our systems and our bodies as we age as low inflamed as possible. And that will help as a side effect, like to reduce joint pain, to reduce gas and bloating, to have better digestion. So it's just like, it's like one thing that helps like everything when it comes to like addressing your inflammation. This is a great study which demonstrated the fact that castor oil supports smooth muscle activation in uterus as well as in the gut to help with laxation. Again, it didn't extrapolate it out to the blood vessels or to the lymphatic systems, but because we know that there's smooth muscle in those vessels, we know that it'll help in that area. And when it comes to working with the eye and castor oil and applying it topically, if you look at how highly vascularized the outside lid of the eye is, now the red is the vessels and the green is the lymphatic system. So you can see how much lymph is around the eye. It's serious business because the eye needs to be drained if there is inflammation, if there is problem, if there are bacteria. The eye is, for all extensive purposes, it's a completely open to the environment, and it's our inside of our bodies. So the eyes, this is why it's important, which we'll talk later, about sterile castor oil for the eyes, because it is literally an open, our insides that are open out to the world, and there can be a chance of bacteria infection very easily without using sterile castor oil. Microbiome balance, these are the studies that discussed microbiome benefits in comparison to like a denture cleaner in the mouth, like a mouthwash. And they found that castor oil was as effective, if not as even better than the actual cleanser for the mouth, which is amazing. And now I just wanted to remind people that things like blepharitis and ocular issues, some of them can be infection based. So we always need to put that into the situation. And then we know it's antioxidant rich. Variety of different studies have shown that it's rich in alkaloids, quercetin, ECEG, again, nitric oxide promoting, and again, also it's a glutathione preserver. So glutathione is, do you know actually, Claudia, where is the highest levels of glutathione in the body?
In the eyes.
In the eye and in
No.
the liver. Exactly.
Oh, the
Right.
liver too. Okay.
Yeah. Yeah, and this makes the correlation between the eye, like the eyes are the window into the liver. It makes it work. So glutathione, this study was actually done on rat lenses. And they took one lens, added castor oil to it. They took another lens and added glutathione to it. And which do you think actually had more glutathione at the end of the day?
The castor oil one, probably.
Yeah, yeah, which is wild because if you think about it, like it's actually like the other lens had literally glutathione put into it. But there's something about castor oil, it like whether it's its vitamin E concentration that's really high, it's not totally clear as to why, but we do know that it helps with preservation of glutathione, which is the body's master detoxification agent, and we need it to be in healthy levels for us to be healthy, which is super key. And then we know that castor oil has this very special molecule called ricinoleic acid. And ricinoleic acid, this is its claim to fame. This is the anti-inflammatory molecule, but it has a very special molecular weight, that allows it to go through the epidermis, which is, you see, is the top layer of skin, and goes deep into the dermis. And in that dermis, you see the circulatory vessels, lymph vessels, you see all of it, right? And that's where the collagen is, the hyaluronic acid, the glucosaminoglycans, all of these different molecules. So that's where castor oil can help with improvement of the connective tissue in between of the dermis and the actual organs. And in the eye, the vitreous area is very, very similar. It's connective tissue. That's why there's collagen in there. That's why with floaters, the collagen starts to accumulate in inappropriate ways and creates clumps and creates floaters. So the fact that castor oil can help with reduction of clumps or reduction of things like that, is leading us to suggest that it possibly can be a very, very big benefit when it comes to floaters. Is there any study on floaters? No. But I'm of the school of thought that if it doesn't hurt you, and if there could be some benefit, even if you don't know 100% what that benefit may be, because it hasn't 100% been studied, which is actually very, very common in natural health and very, very common in medicine in general, because not everything has 100% effectiveness studies sitting in behind of it. I'm of the mindset that if it's safe, go for it. And we know that it's safe because, number one, 81% of lipsticks, or 81% of the content of lipsticks, can be made of castor oil. And you're basically eating that. So we know that castor oil is safe. And we also know that it is an FDA-approved medication as a stimulant laxative, and that has been used for eons and eons and eons, decades and decades, and if not centuries, because it would have been a turn-of-the-century tool that was used for constipation. So very, very interesting. Now we get to it. How castor oil is used for the eyes. I know everyone's on the edge of their seat. I wanted to go as fast as I could, but in order to give you a really good explanation of things, it was really important for me to do the background. But now we're here. And how is it used? Is it used in the eye? Some studies do demonstrate it being used in the eye. However, the castor oil is sterile. There is benefit to it used in the eye, but the castor oil is compounded by a pharmacist and it is sterile. Again, because anytime that you put anything into the eye, it's got to be sterile. No different than those eye drops. Those eye drops are in little sterile ampules because there's a possibility of bacterial and viral infections, parasitical infections of the eye. So we always want to see if we can avoid that, okay? But we've seen it work in castor oil to actually, and I can read this. Castor oil is deemed safe and tolerable with strong antimicrobial, anti-inflammatory, anti-nociceptive, analgesic, antioxidant, and wound healing properties, as well as vasoconstricting properties. Its main constituent, ricinoleic acid, has a bipolar molecular structure that promotes the formation of esters, amides, and polymers. These can supplement deficient physiological tear film lipids, enabling enhanced lipid spreading characteristics and reducing aqueous tear evaporation. Studies reveal that castor oil applied topically to the ocular surface has a prolonged residence time, facilitating increased tear film lipid layer thickness, stability, and improved ocular surface staining and symptoms. So basically, that castor oil is beneficial to the eye and its natural function. But
So really quick, yeah, okay, before we get into the steroid, because we had a question, we talked a lot about dry eyes, but there was also somebody, and I hear that a lot, where the eyes are super watery. There was somebody putting in the YouTube, she literally has to just wipe her face because the water is flowing out of her eyes. So you said about the lipid film thickness. So It sounds like that it could also help, because if you have overactive tears, there's maybe too much, there's not enough of the lipid film in there. So it could also be, that could be an inclination that castor oil could be helpful. I mean, but I don't know. I don't know if you've heard of that.
100%. Like whenever you're using castor oil topically, like let's just correlate it to the digestive tract. Like if we're treating constipation or diarrhea, like an IBS, either the diarrhea kind or the constipation, castor oil, if you go too much, it'll calm down your digestion so you don't poo as much. If you aren't going enough, it'll actually help you to go more, because castor oil regulates. So it's regulatory for the nature of what's going on in the system. So if there's too much, it balances. If there's too little, it helps it to have a little bit more. So that's really the night. And I love that extrapolation. I would agree with you 100%, because it's that oil, the thickness. If you look at castor oil, it's very thick, very different from any other oil. It has a very, very different activity than other oils, and it is very biological compatible. But just when we're putting it in the eye, it's got to be pharmaceutical compounded, and you can actually get a lot of benefits simply just by putting it on topically on the eyelid, which is this example here in this study for blepharitis. So they actually put it topically on the eyelid, and what they found was basically like a decrease in the infection, improvement in the lid, in the eye, differences in crusting. It wasn't crusting as much. So overall, improvements in ocular surface signs and symptoms in patients with blepharitis. So that's a really, really good tool because there aren't very many things that actually help to support blepharitis, but castor oil topically, and for that, you don't need a sterile preparation. So
Right.
all you need is castor oil that is food grade, like Queen of the Thrones, and you apply it topically, and then you're good to go. So that
But
basically helps to
just
optimize.
say for the cataract, for anything in, like, obviously the blood vessel, all that is all around the eyes, in the eyes. So when it comes to like cataracts or floaters, it would probably, to me at least, would make sense that you would have to get the sterile one and put it in the eyes versus around the eyes